Hi, welcome to Forward Science, and thank you for your interest in our prescription strength rinse, SalivaMAX. SalivaMAX is an FDA-cleared, supersaturated calcium phosphate rinse that is clinically proven to reduce dry mouth and mucositis. SalivaMAX is not like over-the-counter options that simply mask the problem, but rather a prescription strength treatment that replenishes the ions that are absent due to the lack of saliva. SalivaMAX is an artificial saliva that moistens and cleans the oral cavity. SalivaMAX is indicated to treat dryness of the mouth or throat for any reason, mucositis, relief of hyposalivation resulting from pre- or post-surgery, infection or dysfunction of the salivary glands, inflammation of the mouth or throat, Bell's palsy, and Sjogren's syndrome, and is beneficial in providing intensive hygiene of the oral cavity. SalivaMAX contains ions that are missing in the xerostomach patient, primarily calcium and phosphate ions, but it also contains bicarbonate ions. As a clinical hygienist, we know how beneficial these ions are for our patients, and SalivaMAX works by restoring these necessary ions required for a healthy mouth. SalivaMAX is very easy to use. It's a rinse and spit solution, so it's non-systemic, has no anticipated side effects, and no known contraindications. It's provided in single-use pre-dose packets. Patients simply mix the contents of the packet with 1 ounce of water in the provided SalivaMAX vial, swish with half of the solution for 1 minute, spit, then repeat with the remaining solution. Patients should not eat, drink, or rinse for 30 minutes after use of the SalivaMAX solution. SalivaMAX may be used more or less often, depending on the severity of symptoms and how the patient responds to treatment, but may be used up to 10 times per day. Patients typically notice results in 2 to 3 days, but due to biologic variability, patients may need to continue to increase their dosage until the desired results are achieved. SalivaMAX is available by prescription only. Simply download a prescription form from our website and fill out the prescription according to the patient's needs. Fax the prescription along with a copy of the patient's prescription coverage card to the number at the top of the prescription form, which goes directly to the specialty pharmacy to be processed. From there, everything is handled between the patient and the pharmacy. Once processed, SalivaMAX ships directly to the patient. With our patient assistance program, patients will have little to no out-of-pocket copay with their commercial insurance coverage. If the patient's commercial insurance does not cover SalivaMAX, or if they do not have insurance, the pharmacy will send them a free 30-packet trial and will contact them with the available pricing options. Medicare or Medicaid patients whose claims are not covered will be offered a discounted cash pay price. Upon completion of this video, you will be receiving a shipment of SalivaMAX starter kits. Each kit is intended to be given to a patient to begin treatment with SalivaMAX while their prescription is being faxed and processed by the specialty pharmacy. Please note, the starter kits are not intended to be broken up between patients. 1 starter kit equals 1 patient. As clinicians, we've been depending on over-the-counter options for decades now, even though we know they don't work. Forward Science has finally developed a solution that works. Your patients need relief. Go with what works.